Welcome everybody. I'm going to get started. Thank you all for coming. Thank you so much. And I'm very excited because this is a little different than what I usually do. Usually I talk about things that we should be doing once we get old or older, and all the big interventions like facelift and eyelid surgery and stuff. And then I realized, why not catch them on the other end when they really need to learn a lesson and know that if you are really good about it, you can stop the aging process and continue to preserve your beauty, so you never have to go through big things like a facelift or eyelid surgery or neck liposuction. Is that possible? Yes. That's what we are going to talk about today. And before we get started, I want to quickly thank all of you for coming. I want to thank Susie, my office manager. I want to thank Liz, who's actually in the back checking everybody in. And I also want to thank Gina, my esthetician. She's sitting in the corner, for coming. And she started recently with us, and she is fabulous. So if you haven't had a chance to work with her, if you work with her, you will like her. And a couple of things we want to cover before I start the presentation. For exit signs, that's the emergency exit if you decide to leave. Bathrooms are upstairs. You have to get the key from the front desk. And you have brochures. In the brochures, you'll find information that's relevant. And also, the most important thing to remember is that I am doing something different than routine. Everything that we are doing right now is being live broadcast on the channel, Janjua Facial Surgery, on the website ustream.tv. I emphasize that because, in normal casual settings, it's very easy to forget that you're being watched. Right now, there could be a small kid in Romania who's hacking around, looking around, and suddenly comes on this thing, and it's like, oh my God, mommy, look, come here, watch what I found. So that's the beauty of internet, and that's unfortunately the scary part about internet as well. I made a deal with my 11-year-old that she can watch it as long as she has finished the homework. So, Simone, if you hear me, remember, if the homework is done, you can watch it. If not, please turn it off. Mom will tell me. She will tell on you. So, okay. So let's quickly get started. I have a lot of familiar faces here, so I don't need to introduce myself, but I am Dr. Janjua. I'm a board-certified facial plastic surgeon. My practice is right across the street, and the practice name is Janjua Facial Surgery. We are very active on all the social media, so if you're on Facebook, please like us if you want to. This way you get all the information that comes along about these seminars, the specials, and everything else along with that. And if you have any questions anytime, you can always reach us through the email as well. We check the email every day, and the Facebook postings as well. And we are a very friendly office for the ones who already know, but the ones who don't, it's a small office, so it's very easy and very patient-friendly, so you don't feel overwhelmed. Because people who go for the first time to a plastic surgery office can feel really overwhelmed, and can be a problem for many people to come. A lot of times I've noticed that the first-timers are looking for a girlfriend to go with because it's just too much. So you really don't need a girlfriend to come to our office, trust me. Okay. So when I started working on this presentation, the very first thing that came to my mind is, who's my audience? Who am I going to talk to? And suddenly I said, wow, maybe it's the X generation, it's the Y generation. I'm like, I really don't know the exact definition, so I had to look it up. So I'm sure many of you know the definition. I did not. So the baby boomers that we hear about a lot are the people who are between 1946 to 1964. And today they would be between 51 to 69 years old. So that's the generation that boomed after World War II, and we have a lot of those, and God bless them because they are really keeping plastic surgery people very busy. So because they're living longer, they're staying healthy, they're doing a lot of fun stuff with their life, so good for them. Then came Generation X. So yes, that's the proud me right here. You're looking at Generation X. Born between 1960 and 1980. So that would make us between 35 to 55 years old. And that's a generation that's kind of like in the prime workforce at this time. Everybody's peaked in their career. They found their mate or companion. They're kind of like settled in life. And they're on kind of like autopilot till the next stage hits them. Hopefully everybody's ready for that. Lastly are the millennials, also known as Generation Y. Generation Y or millennials were born between 1980 to 2000 because after that a new millennium started, so they are called the millennials. And they are between 15 to 35 years old. That is the target population that I'm trying to speak to today primarily. However, it is educational for everyone, including myself. And I'm hoping that anybody who is listening or watching, even on the internet, they pass a message along to their girlfriends, to their boyfriends, to everybody who's young, that if you start early, you can really do very well. So we will get right into it. So why start young? That's an important question. The number one reason is that prevention, an ounce of prevention is better than a pound of cure. And that is so true. You start early, you will not have to deal with a lot of issues down the road. And that is the number one reason. Second thing is that this is the age for the millennials when they start their courtship process. Many of them are in the middle of they're getting married or dating and getting engaged. I mean, those days are very tough days. All of you who are married or have a companion, just for a moment, take yourself back to that time. Because I did it while I was making the presentation. I was like, boy, that was tough. Trying to look good all the time, trying to impress the ladies, and trying to say my God, can I find a nice pretty woman? How am I going to do that? Those things, and same on the opposite gender. Those are tough times. Those are not easy. So women going through that, if they feel that, my chances are better of finding a better mate by looking good, don't feel embarrassed, because guess what? Women have been thinking that forever, and it will never change. That is from the cave times, and it will continue till the end of times. So there's nothing wrong with that at all. And that goes true for second beginnings as well. When you're in the middle of second beginnings, guess what? I hate to tell you, you're back in the same situation, where you have to compete. And when you're competing, you got to put the best shoe forward. I was wearing scrubs all day today, but I had to impress you. I'm like, man, I got to go in a suit. Let's go get a suit. So dating is the same way. You have to. So on a serious note, it really is. When you want to find a good partner in life, you go through a lot of people sometimes. Sometimes you get lucky. But the courtship process at this age for the millennials, 15 to 35, it really helps them. So it's very important. Next thing is self-esteem. Self-esteem applies to all of us, but at that age, in your 20s, I think it is still modifying, it's still changing. And I can only speak for myself. So I remember I was morphing into something, and I was trying to figure out who am I, and what do I need to be, what do I need to look like. Believe it or not, I used to have a beard and a mustache in med school. So by that time, when my courtship started, I realized, actually I didn't realize, my present wife's best friend told me, she said, gotta tell you, if you want a girl, the beard's gotta go. So I was like, wow, my goodness, 8 years of beard's gotta go. It went, and the girl came. So, so self-esteem, definitely, those issues are very important, because you're still kind of developing, and this is the time when you can kind of overcome any issues that you might have had as a child in the self-esteem issues related to the appearance. If you had a big nose and you said, listen, you never thought about it, but what, I want to do it. Or your ears used to stick out and you always wore your hair down because you were trying to hide them. You can fix that, and that will definitely help with the self-esteem as well. There's a common notion that plastic surgery is all fake and it's not really healthy. That's not true. That applies to people who take it to the extreme. For normal people, it is very healthy to fix something that they feel is really affecting their self-esteem, and it is also validated by the surgeon or the doctor they go to, saying, yes, indeed, this is something that's fixable. I had a very pretty young woman come in her 20s for RHINOPLASTY. She's a nurse, she's very smart. She said, I know my nose is great, I know I look pretty, I just have one small issue with the nose, and I want it done. But my mother is fighting me on this. If I bring her in, will you talk to her? So I said, first let me examine your nose so I can speak the truth and say, yes, indeed, you need something. And she was absolutely right. She was very pretty, but the nose did have a little hump and a little deviation, which was not noticeable in pictures or by other people, because everybody said, wow, you're so pretty. And the same thing her mom thought. But when she brought her in, I had to explain to her that she is doing it because this is a small thing that bothers her, and it is fixable. She's not, going really crazy on this issue. And then she understood. So that's very important to realize that self-esteem can be helped with properly indicated surgery or other interventions. Last thing is career advancement. This is also, this is true at all stages of life, not just for the millennials, because unfortunately, we are living longer, and it is a known truth and a known fact that people who look better, they get better jobs, they make more money. They've done even studies to prove that. So that might be considered superficial. But unfortunately, it is the truth. It's the white elephant in the room. We can't deny, we can't hide from it. So either we can just be against it or we can embrace it in a good way. And I think we should embrace it in a good way and not look down upon it. So especially in the age when you're in your 20s, you're building a career, you're starting out, I think it is important that if you learn to maintain yourself, you will always be that girl that everybody says in the office, like, wow, she's always looking good. You'll always be the guy who's always well-dressed and looking good, because then you develop that pattern that follows you through life, and it becomes a habit. It's very hard to change the habits down the road, because you already are set in those. Now, goals as a young person, what should be the goal? So the goal should be to prevent facial aging. That's the number one goal, because you all are going to age, we are all aging, but we have to prevent. Second is maintain the youthful beauty that peaks in the early 20s. That's when everybody looks good, and that's good and bad. Good because that's when you need to look good, but the bad because you don't think of, I need to do something. I mean, that's why this hall is not full, because at that age, women are like, listen, I can make heads turn. Why do I need to bother? You need to bother because one day you won't. And this is exactly a quotation from one of my patients. She said, I am shocked. I'm like, why? She said, I was at the beach and these three guys just walked right by, and I was like, wait a minute. I used to spin heads and now nobody even looked. She was shocked. And I explained to her, I said, you're very beautiful. You still are. But remember, with time it changes. It's not the same. So all those young ones who might be listening on the internet, they need to realize that you might be the homecoming queen. But one day it will change. If you want to preserve it, you might consider starting now. It will take less and it will give you a lot more. And the last thing is enhancing the appearance. And I don't mean in an artificial way, but enhancing in a youthful way that goes along with the appearance, that goes along with what you are, and not trying to overdo anything. So how do we achieve these goals? These are the things, and let's start with it. So I'll say we achieve the goals by skincare, skincare, skincare. I'm sorry, did I say it 3 times? Probably because my esthetician is sitting here, that's why. So I'm trying to drum up business for her. No, but in reality, I think that is the reason, that is the number one thing. Here I am, I'm a plastic surgeon, I love to do surgery, and I have really no interest in skincare, then I know it's very good. But I could operate all day and be happy, but if I had to do skincare all day, probably I would be bored. That's not me, but I know that for patient's perspective, not my perspective, from the patient's perspective, the number one thing is skincare. I mean, that's something that's so easy to do, and if you get into it early on, you will prevent a lot of aging. And that's what I think I need to emphasize for everyone, especially the young ones who are listening, because we don't have any excuse anymore. It used to be, in the 50s, there was no sunscreen, there was not a lot of awareness, but now we see people dying of melanomas, now we see people aging and wrinkles and everything. We know, and we have great sunscreens and other mechanisms to protect ourselves, so there's really no excuse for the young ones not to do skincare and maintain their looks. Structure care. Structure means your bone, your soft tissue underneath the skin, and I'll tell you how you take care of that and how you can maintain that as well, because that usually is the hardest part. Hair care, makeup, dental care, all these things, these all combine together and they get into the image of your face. Everything together puts it into one big collage that really looks pretty at the end of the day. So I'm not a dentist, but still I know if somebody has a crooked smile because of the teeth, they need to fix it. That's very important because it's all image combined together. And when I do my facial consultations, I always start with the skin and then I go on to hair, and usually I get a look by the woman like, what is he talking about? Then I talk about makeup. And then finally they're like, well, what about my nose or my ear? I'm like, I haven't even started. This is just what I call the accessories of the face. Your hair, your skin, your makeup. Accessories are very important. So those things need to be taken care of. Obviously, I will not be talking about them, but I just wanted to emphasize so everybody knows that. Next thing, so beauty begins at birth, because when you're born, you could be very lucky. Most babies are born cute, they're flawless. To all mothers, all babies are flawless, but we do know that there are congenital abnormalities that can happen, and those can be treated. Some of the common ones are listed here, like NEVUS sebaceous. This is a little bald patch that you might see on a baby's head, and the hair doesn't grow there. And it looks a little silly, but it is dangerous because when they become teenagers and the hormones start, that bald patch of NEVUS sebaceous can turn into a carcinoma. I've seen many of those, and I really used to think, yeah, now they make a big deal in the medical books. It's not going to never turn into any cancer. Till I saw a guy, a 45-year-old guy, who did get that cancer, and I was like, wow, I guess the books are right. It does happen. So it does happen. Moles. Moles are not a big issue because kids usually are not born with moles, but if somebody is born with a big mole or multiple moles, then it can be a cosmetic issue, and it should be dealt with early on. Portwine stain is a big problem. That's congenital staining of a certain part of the face of the body with pinkish color like a portwine, and the good thing is now we have great lasers to help with those issues. So you don't have to spend your whole life with that big stigma or trying to hide that with makeup and cover-up. And if somebody ever has to, one of the best cover-ups is Derma Blend, which I think Macy's carries it someplace, but it works really great to cover all of these things. Accessory auricles or ears, very common. I see a lot in little kids. They come as babies. It can be very small, can be very big, and takes me back to my childhood days. It sounds silly that somebody could have a big problem with little tiny little snubs sticking out of the ear, but I remember very clearly, 6th grade, sitting next to a very good friend of mine who had one. I was not an angel always. I became angel later in life, so I used to play with a little thing every now and then. And that friend of mine would be like, can you leave the thing alone, please? And I would just say, I'm sorry, I just can't help it. So every time I talk about it, it takes me back. I'm like, yes, the little thing can become a big issue, so we need to take care of those things. Dermoid cysts are congenital cyst masses that can grow on the face anywhere, and some of them can be dangerous as well. And they need to be worked up properly before they are removed in terms of MRI or CAT scans. Congenital skeletal deformities of skull and jaw, those are very complicated things, and those usually have to be dealt in a big tertiary care center with help of multidisciplinary teams who are dedicated to those very, very unusual problems. And the same applies to cleft lip and cleft palate. So those are unique problems which are truly, truly bad in terms of the facial appearance, and we can get good results with early intervention. Last thing, Dumbo ears, and those are also called protruding ears or bat ears. A common problem if in people especially of English descent, and the good thing is it's very easily fixable at a very early age before you have to be tortured. So this shows you the accessory auricles. You can see it can be very small, like just a little nub. It could be a little big, sticking out like 2 little nubs, or a big thing sticking in. It can be almost like a second ear in rare cases, and it can be very easily removed at a young, early age. For my patients, I wait till they're at least like 6 months old, and then I do it in the operating room. This is Microtia. This is complete absence of ear, where you literally don't have any ear at all. And you can imagine the distress if you have to grow like this. So good thing is there's a lot of reconstruction available, and it can fix the ear. That's hemangioma, just a vascular abnormality. Kids can be born with those things. And good thing is that now they can get certain medications and lasers which can almost completely get rid of them. So these have good prognosis. Same with the portwine stains. Just like I said, lasers at an early age can make a big difference. These are dermoid cysts, and these are not just ordinary bumps. These are congenital, so sometimes they could be tracking under the skin. For example, the one typically we see right here on the nose, it can, in small number of cases, track all the way to the brain. And the reason for that is that that's the congenital plane where the brain is developing and going from the nose upwards, if you can imagine. And that's why you can have this little going in a connection all the way up. So these are cosmetic issues. Sometimes kids grow up and it's never been removed, and finally when they're adult, they say, I've had this bump all my life, can you take it out? Yes, it can be removed very easily. Nevus sebaceous can happen even on the face. Typically on the scalp, you'll see in the next slide, but it looks like a raised yellowish area, and this is a teenager, who had it all her life, didn't know what it is. She removed it for beauty reasons, and the biopsy came back, the precancerous nevus sebaceous. So this is a typical presentation, and it's a bald patch, and hair does not grow through it. And if you ever see a baby where there's a patch and it's not growing through it, it is a nevus sebaceous, and it needs to be evaluated. Prominent ears. So that's one of the most common things we see, which can be distressful for kids. It can be fixed early on, and it has been called many different names. The timing is preschool, and the reason for that is several. One, The problem begins in school when kid starts kindergarten and there's some other kid who just focuses on the ears and makes fun of that kid. It can be devastating. We have great, rules in school these days on bullying and all this stuff, but despite all that, still there can be some, unfortunately, kids who become mean-spirited and they can really ruin somebody's life. And trauma at an early age can go on for a very, very long time. So we try to do it before kindergarten. We cannot do it any earlier than that because it takes about 5 years for the ear to develop enough that if you were to do surgery on it, you will not change the eventual appearance of an adult ear. So we cannot do any earlier, but definitely by age 5, we can do it. And the techniques have improved significantly, anesthesia has improved, so there's really no concern as a parent if you said like, wow, I have to put my child to sleep for this. Yes, you can, and it's not going to be a big deal at all. So these are just some examples. You can see that, the ears can stick right out of the hair, and it seems like a, funny little thing, silly thing, but it can be distressing. You want it to look normal where you can put your hair behind your ear and not think twice about it. And as a parent, I think it is, very hard to see your child with something that, that doesn't look right. And, especially if it can be fixed, I think most parents will be all over it like, need to fix it. And looking from behind as well, you can see that the ears stick out a lot. And once you fix it, you don't have to worry about it at all. And there can be difference between the right and the left ear. And there are times when it's only one ear, not both ears. In this case, this was the main ear that had the problem. Okay, so let's get to the real thing. How do we prevent a facelift? That is the goal. So for all the young ones who really want to know, wow, and can I do it? Yes, you can, because, not only because what I am telling you right now, but because as you age, there's going to be a lot more stuff coming along the road, which is going to be even better. So if you start now with what we have and combine with the future stuff that's coming down the road, I think really you can prevent a facelift. Absolutely you can. So first, let's understand what happens to the face. What changes with time? The easiest way I can describe is, think of a baby as a grape full of juice and volume, smooth skin, completely wrinkle-free. And then as the baby is beginning to age, it starts losing the volume. It's like becoming a deflated balloon. And then the wrinkles start showing up, and you turn into a prune. That's the easiest way I can explain it, because you're losing your bone, your cartilage, your fat, your collagen, everything is going away slowly and gradually. So we need to stop that transition at some point. And the sooner we start, the better it is. So think of it as this way, that there's two things you're dealing with. One is your skin. That's the envelope. And the skin envelope has contents inside. So this is your skin envelope right there. That is what you show. And that's why it's so important. I really think it's half the beauty of the face, the envelope, which is the skin. And then underneath is the structure. That's the structure, and that has a lot more stuff in it because it has muscles, it has bone, it has fat, fascia, a lot of stuff. And you have to take care of both of these things to prevent the aging process. Taking care of this is easy because we have made a lot of advancement in skin care. Taking care of this is difficult because we still have not found a way to stop the bone loss that happens in all bones, and especially in the face, because a tremendous amount happens in the face. It's just not known because nobody talks about it. People just talk about the hips and the back. But if you do a CAT scan of the jawbone as a young 18-year-old and then 80-year-old, it almost goes half the size. So there's a tremendous loss, and that's where the cheekbones come down as well. And same applies to fat and the muscle losing volume as well. So then, let's look at the skin. Skin changes in several ways. One of the ways is the texture. The texture becomes thick. It loses the softness, the smoothness, and it loses the elasticity. It does not bounce back if it is stretched. So it doesn't look as nice and as firm. Color. The sun damage leads to blotchiness, where you have browns, you have reds, you don't have the beautiful pale color that you were born with. And trust me, people, pale is beautiful. It is the fact, because you can always put some bronzer on, but you can't get that pale back once you've destroyed your skin. With age, you also lose the pigment. Sometimes people say, like, the old person was looking ghostly. Why? Because we lose the real pigment. We all lose. They have done studies and it shows that actual pigment starts going down as we age. So the color and the texture affect the skin in a negative way over time. Then comes the soft tissue. So we lose the volume of fat, collagen, and elastin. Same with the bone. And it changes the shape. So the approach would be to prevent and then to maintain. So you have to prevent future damage and you have to maintain what you have. So you're trying to stop your face at that spot. If you can stop it at that spot where you are, you're way ahead of the game. And remember, aging starts at birth. It's never too late. You know, it really is. This morning I saw somebody, a nurse that I was working with, eating chobani. And she said, wow, you know, this is about your talk. I'm like, what do you mean about my talk today? She looked at the can and said, preserve yourself. I'm like, you're absolutely right. I'm going to use that line, preserve yourself. So that was very interesting, and that's so true. So there are two approaches, inside out and outside in. Inside out means that, you know, unless you have a healthy body, you know, you're not going to look good no matter what you do. And to have a healthy body and mind, you really need to work. And it's very simple. It's about exercising, eating healthy, not smoking, drinking caffeine, all this stuff. So you already know that. Just remember that that is essential. That really is essential. Then, now what we can do is outside in. It starts with the skin again, and then we work our way down to different modalities. What are the modalities that we can use on young people in their 20s that will keep them looking young? Again, skincare, skincare, skincare. I'm sorry for repeating it, broken record, but that's the reality. And I'm also hoping if my daughter is listening, she will finally listen to Dad and tell what I tell Dad. I have all the products for free. She has access to everything. She throws them in the garbage. I'm like, oh my God, there's $80. So, skincare, then laser hair removal. That's just a side note because when you're young at that time, sometimes you're not thinking of laser hair removal. You're very young. You just do, you know, you shave your legs or you thread or you wax, and you don't even think twice. But that is something you can address. And if you start early on, you'll never have to worry about your hair. Radio frequency tightening devices. There's a lot of them coming out. My favorite is Thermi, and I'll talk about that in more detail. But I think that has been the biggest advance because there's not a lot of no downtime, non-invasive stuff that can tighten the skin because we are losing volume and we are losing elasticity. So for the elasticity, yes, the creams and skincare will help, but it won't do anything dramatic. With the radiofrequency devices, you keep using them as you age, you'll keep your skin tight. If your skin envelope is tight, you will continue to look good because a lot of the problem is the skin envelope is becoming loose with age. Then comes fillers and biostimulators. That's for the structure part of the face. And Botox, again, is for both of these things. So let's get in a little bit more detail. So skincare. Skincare is, you know, excellent in terms of use. It's very easy to use. There's no needles. It's part of your routine. Once you get into the routine, you don't have to think about it. In terms of which one to use, they're all good. So please don't think that there's like one magic one. There is none. It's better to use any skincare you can find your hands on as opposed to just trying to look for that magic one because there is none. And if you ask me what I use PCA Skin Care in terms of using in the office and using myself. Why? Because I just adapted it long ago after some research. It seemed to be the best and it has served me and my patients very well. So I use it all the time. Now, the principles of skincare are cleanse, so you clean the skin, tone, tighten it, correct any deformities. If you have acne, correct the acne. If you have lines, correct the lines. If you have pigment, fix the pigment. Hydrate, very important to restore the moisture, just like you drink water to restore it in the body. Skin needs it too. And then protect it from damage using a sunscreen. So if you follow this routine with any skincare line, just follow this and you can pick out your own skincare line. Say, I want something to clean the skin, then tone, then correct, hydrate, and protect. You're good to go. If you were to ask me and you came to me and since I know only one skincare line, this is the one I would tell you that I use. In PCA Skincare line, for most of my patients, I use Creamy Cleanser, which is very soft. For patients who might have thicker skin or a little bit oily skin like myself, I like the Gentle Exfoliant because that really gets rid of all the oil and the sebum that's clogging your pores. Then comes the toner. That's my favorite thing because that's the first skincare item I personally started using because I noticed one day my eyes were becoming a little old looking and the skin looked like crepe paper. It's very distressing. I finally realized what women feel like when they look in the mirror. So I have a huge empathy now. So I immediately took the nutrient toner and I started working with it on my eyelid skin. Within 6 weeks, I saw a change and I became a believer, and I've been using it since then. I use it differently than a lot of estheticians would tell you, because they think toners maybe are not good for your skin. I think they are very good and they really help. Then comes vitamin C and E cream. That's the standard that I have everybody use because they really are proven to work. I'm not a big retinol guy because that can be very irritating and it also makes your skin look red down the road, so I'm not big into that. Acne gel, that's just to correct acne if somebody has acne issues. And then hydrate. Collagen hydrator is the one that we use from PCA and it's excellent. It feels very soft and smooth. And lastly, use this sunscreen. A lot of people are concerned because they react to sunscreen, or they feel it messes up with the makeup, or they feel they might break out. So I tell them I've been using this on babies since they were probably 6 months old. And they ask which babies, like my babies. So I know that it probably is safe for adults as well. So please, if you find a sunscreen that suits your skin, don't find an excuse that, oh, I can't use it for this or that reason. Find a sunscreen that works for you. Laser hair reduction. So very quickly I'll cover it. And removal versus reduction, because we used to think we can get rid of all hair. That's not true. There's always some amount of hair that is very stubborn, and no matter what we do, it will stay. That's why we had to change the phrase to laser hair reduction. But reality is, the hair, once it's gone with laser hair removal, usually it's permanent. I really don't think most of it comes back. Why do it? Ingrown hair is a pain in the neck. Skin irritation from shaving. Time commitment. It's a lifelong thing to shave, thread, or wax. So if you can get rid of it, why not? But again, it's a personal choice. The only place where I would strongly encourage someone to do it is if somebody has it in the mustache area. It's like, you know, why would you torture yourself with just threading all the time? Just do and get done with it. Types of laser, there's diode, IPL, YAG, 3 different kinds. In my opinion, the best ones are the diode lasers in general, and I'll show you the one that I have. It's a diode laser and works very well. The types of hair in order of best results to the worst results. Black hair gets the best result. Brown is next, red is next, blonde, very little, gray, 0. So it's important to know that, because if somebody is getting to be my age and they say, you know what, finally I should do something. I had the same idea. I'm like, I'm tired of this little hair growth on my ear, so I started, I'm like, I have the laser, I've had it for 10 years. Let's use it. So I did it, I was very excited. A month goes by, I look in the mirror, I'm like, what is going on? I gotta return this laser, it's not working. But then I look a little closer, I'm like, oh, age, white hair. I'm like, young man, not so young anymore. So please keep that in mind. If somebody's thinking of it, once you get to the white hair, forget it. It's not going to work. Types of skin, it can work on all kinds of skin. It's just that the more pale you are, the more we can crank up the settings and get a faster result. And if you're darker skin like me, or even darker, then it takes a lot more sessions. That's the only difference. Age to start, whenever you can handle the discomfort. I've looked into it a lot to see what is a safe age, and all the data shows whenever you can tolerate it, it's perfectly safe to use. And long-term effects, happiness and lack of razor burns. This is a machine that I use. It's called DUET Light Shear by Luminous. They're a leader in the company. It has 2 hand pieces we use. For the lip or the small areas like the ear or the nostrils, we use this tiny little tip. For bigger areas like the arms or legs, because it takes a long time to do it, the big handpiece works very well and very fast. Before I go on to this, quickly about the laser. Sometimes patients ask me, like, is it dangerous? Because it is radiation after all. Because laser stands for LASER, light amplification through stimulated emission of radiation. So that is radiation. So the problem is that all radiation is now the same. There's ionizing radiation and non-ionizing. X-rays for the chest when we get, or a CAT scan, that's ionizing. And that is likely to cause cancer if you get a lot of it. However, non-ionizing, which is this one, is not going to cause any DNA damage or cancer, so it's perfectly safe. Let's move on to the next thing, sun protection. Sun protection is critical. I've been talking about it all this time. So this is a key. And I looked up in the textbooks to make sure that I am saying something that is true. And it is true. I checked it several times. Up to 70% of the skin damage can be attributed to sun damage. And that is a big, big thing. So that's why sun protection is critical. We have the sunscreens now. We also have the protective clothing for summertime, UV clothing, which is excellent. We have the hats you can wear that go all the way in the back. We have put pills as well now. It's in the initial phases where you can take these pills and they give you protection, but it's a very small factor. It's only SPF 3 to 5, and it's not enough to protect you. I think one day they will have the pills that you can take in the beginning of summer. It'll get you enough protection that you can go through summer without getting burned. But we're not there as yet. Not only that, we don't have enough data to see if there are any significant side effects of these pills, such as the polypodium leukotomas. So it's just an FYI, don't start looking for the pill as yet. Next thing is very interesting. I found that there are some UV awareness bracelets and also apps on the phone. So if you're wearing your iWatch or something similar, they might have apps where if it is exposed to UV for long, it might give you a buzzer saying, you've been in the sun too long, get back indoors. And so those simple things seem simple and silly, but they can definitely help. Absolutely. So I think the young lady should one day get one of those watches. Sunscreen problems. So there are some problems as well that I think you need to be aware, especially the parents who are applying them, because I also learned it by reading about it. Inhalational damage. There's a lot of spray ones which are great to use on the beach because you're wet, you can't put it on, but also always keep it away from the face because there are incidents of developing allergies and asthma and other problems from inhalational injury of these sunscreens. Long-term effects of some of these products are not known, especially with the nanoparticles coming out. We do not know if the nanoparticles get into our system and what do they do in the long term, because nanoparticles are very, very highly absorbable. So just be careful with that. And lastly, if you do develop some allergies and sensitivities, then try to find something that is very soothing, organic, natural, that goes along with your skin without any problem. And the last and most important thing about sunscreen and sun protection is vitamin D deficiency. Many years ago, I gave a seminar, and I have one patient sitting here who was there. I don't know if she remembers that or not, but I don't like to point her, so I'm not going to point to her. But at that seminar, somebody raised a very good point, and I wasn't even aware of it at that point, the significance of vitamin D deficiency. So I looked it up over time, and what I learned was very serious. Vitamin D deficiency causes a lot of simple problems like aches and pains, but also if you get a cancer, something like, I think it's colon, breast, and a few others, but I'm not sure, it's a few cancers. If you get those cancers while you are vitamin D deficient, those usually turn out to be the more aggressive kinds of cancer. So vitamin D deficiency will not cause cancer, it does not. But if you do get a cancer of certain type, it'll be a very aggressive one. So please make sure that if you have not done so, get your vitamin D levels checked. I was shocked when I found that I was deficient because I never thought, being a brown person, you could be vitamin D deficient. Yes, you can. Yes, you can. So it's very important to get that checked. Skin health maintenance. So how do we maintain the health of our skin? Facials used to be big. You know, they are fine, but I'm not a big fan because in facial there's a lot of trauma to the skin that can cause tiny telangiectasias, broken blood vessels, and then your skin becomes red down the road. So, I don't think it's a great idea. It's okay as long as it's done gently. But I think what is better is two modalities that we use in our office. I really like those. And thanks to Gina, she really got me into these two things, and I have really, enjoyed having those in my practice because they really work very well and are very safe. Microdermabrasion and also Rejuvapen. Microdermabrasion is vacuum cleaning the skin. That's exactly what it is. And I like our machine, and I'll explain to you why in a second. Rejuvapen is one of the dermal pens. Dermal pens are pens that have tiny needles on the tip. As you go over the skin, which has been numbed prior to the procedure, it pokes tiny holes, just like tilling the soil. And those tiny vertical holes then heal with collagen formation. And those thousands of tiny collagen columns together tighten the skin in the most superficial part of it. And the skin looks firmer and smoother. That's what it does. Last thing is THERMISMOOTH. When I get to the picture of THERMISMOOTH, I'll get into more detail. DERMASWEEP. This is the name of this microdermabrasion machine. It does two things. First, it does what all the microdermabrasion machines do, is vacuum clean. So that's the tip which has a suction. You go over the skin. It has different tips depending on the area you're treating. You can do the body with the red tip because it's very aggressive. You can do green or black for the smooth face area. After you vacuum cleaned, now all the pores are open and the skin is ready to absorb stuff. And in the past, all the estheticians would then put a cream by hand. But this machine is really good because you can pour liquid and use a different handpiece to push it into the skin through those open pores at that time. And this way, there's maximum absorption and all the nutrients you're putting in get absorbed and give a spectacular result. So it does three things. One, it is exfoliating, so you're getting rid of all the dead cells that are clogging your pores. Second, just the mechanical motion of it is causing increase in the circulation of blood, which helps the skin. And lastly, it's infusing. And you can pick one of these different infusions depending on your skin quality. If you have acne issues, there's a specific one. If you have hyperpigmentation, there's a specific one. If it's just aging, there's a specific one for that too. So that gives a whole breadth of opportunities and options to the esthetician to work with individual skin. Then we come to the Rejuva pen. So this is an electric pen. At the end are tiny 9 needles, and it goes very fast over the skin. And it does not hurt, because patients think, oh my God, 9 needles? No, they're very fine, very superficial, and after applying the cream properly, it is not an issue whatsoever. And there's really no downtime. That day you might look like you were a little blushed for the evening, but starting the next day, you're back to normal. THERMISMOOTH. This is, I think, probably the most exciting addition in my practice. Radio frequency is the technology behind this device. Same thing that's behind Thermage and Altherapy and a lot of other technologies. So radio frequency can cause heat generation in the tissues. That heat generation can stimulate collagen growth and also collagen contraction. So it helps by doing two things. Collagen contraction, which translates into the shrinkage, almost like doing a shrink wrap on something, shrinkage of the skin, tightening the skin, and then collagen growth that happens slowly over a period of months that bulks up the skin and minimizes the wrinkles. So those two mechanisms, through the use of radio frequency, tighten the skin. ThermiSmooth has three portions. One is a generator that generates the energy. Second is a thermal imaging camera where you can monitor the temperature if you want to see how high the temperature is going. Because we know that if you get above 47 degrees centigrade, you can burn the skin. So we have to maintain it below that. And this is the handpiece. It's literally the size of a pen. It has a metal tip at the end. The metal tip starts cold and starts getting hot. But as you're moving along the skin does not burn because you keep moving and it never gets to the point where one area will get so hot that it will burn. But it does get to the point where the critical temperature can start making the changes in collagen production. It takes about 5 minutes, at the most 10 minutes to do on the face in the areas of the eyes and the lips. Those are the two most common areas. But I have a strong suspicion that going forward in the next 10 years, devices like these are going to be used to firm the whole face. And they already are working, the company's working, and they're in trials right now for a piece that's going to be about 3 to 5 times bigger than this, and they plan to use that on the body. So they're hoping that they can just go over the whole body and tighten the skin everywhere. That's what they're planning to do. And the trials so far, what I've heard, are going very well. So this, I think, is going to be the future for pretty much everyone who wants to maintain the firmness of the skin with no downtime, with no special preparation. Because other procedures do need some preparation and they have longer downtime, but this literally is no downtime. So I'm hoping that this continues to get better and better. And in our office, at least, we're very busy with this device. Gina uses it, and she uses it around the eyes and the lips, and the feedback has been phenomenal so far, to the point that I want to be the next patient if she can find time for me, which is hard. So these are some of the results, not mine, from courtesy of some of my colleagues, because I just started using it 4 or 5 months ago, so I don't have enough follow-up. These are the patients you can see where they have folds on the eyes, extra skin. And now you can see that folds have been significantly reduced. This patient, came to me, I would say you definitely need eyelid surgery. But now with ThermiSmooth, I really have to think twice with my patient, like, does this patient need the eyelid surgery, or can I get away with ThermiSmooth alone? Because for patients, it's great. No surgery and you can have it done, that's like a no-brainer. And you can see how this hood has been lifted, right there. And the lip lines have been smoothened. And that's great because trying to get rid of those lip lines is very hard, even with the fillers. And that's temporary. But this becomes a lot softer, and then if you use a filler, it makes it even better. But that's not what I'm trying to propose here. What I'm trying to propose is people who have no lines on their lips, and they say, why would I do that? Yes, you are the prime candidate, the younger one who do not have the lines, because you don't want to get to the point where you get the line and you're like, I think I'm ready. No, you're not ready, you missed the boat. You had the technology all along. Why didn't you use it? It's like, I've done Sculptra on my face, I've done Botox for 7 years. Why have I done that? Because I learned from my patients' mistakes. And I was young, and they said, oh, you have a baby face, you have a baby face. They all used to, and nobody took me seriously because I looked so young back then. So then I realized, wow, I need to prevent what I'm treating. So I started doing it, and patients would say like, oh, you don't need it. I'm like, well, I know I don't need it, but I don't want to be in the situation where I have to fix those deep lines in the forehead because I know how hard it is for me to treat those lines for my patients, especially when I can't use the Botox down the road. So it's all about starting early when you do not have these lines. So let's say if my daughter came to me and said, Dad, I'm 15 now, what do you want me to do? So once she's 15 to 18, those years, I would say, okay, come on in, I have free time today, let's do some THERMISMOOTH. It's no different than having a facial done, let's do it. And that will continue to preserve that collagen that's there and maybe even enhance it a little bit. And devices like these, I have a strong feeling will become actually available in the spas in the next 10 years. Just like microdermabrasion was only in the physician's office in the beginning, then it moved on to the mainstream. Botox only the physicians could do, then it went on to nurses, and now some places anybody can do it. Not legally though, but I'm amazed what I hear sometimes. So what I think is going to really be a big thing in the future, and for good reason. So the Botox is very common. Botox has a great preventive role. I just gave you my personal example, and I think that's very important for everyone to realize. There are 3 different kinds available in the market right now. Botox, the original one, and then Dysport, some people call it Dysport, and then Xeomin. They all work well. There's no special formula in my personal experience. I've had better luck with Botox and Dysport than Xeomin. So primarily I use Dysport, but in the area between the eyebrows, sometimes I use Botox. Both work great. They last up to 4 months. Yes, they are not long lasting. I've had patients ask, why can't they make one of these that lasts for long? It's so expensive. And I tell them, I'm so happy they haven't made a long lasting one, because if you have a problem with it, you're stuck with it for a long term, because it can cause droopy eyebrows or droopy eyelids. It's a rare thing, but it can happen, and it is not worth it. So this might sound expensive, but if you start early, you don't need as much. You need it very infrequently, because you are not allowing those muscles to become strong. You are numbing them up to the point where you will need Botox maybe just once a year down the road, because you're not letting it grow. The muscles in the face are like the muscles in your biceps. The more you exercise, the bigger it gets. You don't use it, it goes away. So that principle allows you to prevent the lines, and also with time, you don't need as much Botox. Same thing with Dysport and Xeomin. These are just some examples. In the forehead, you can see the lines. You do not want these lines to be shown at rest. And if you never do Botox, at some point, they will show at rest as well. Now here is completely smooth. The area between the eyebrows, called glabella, and then the crow's feet. A lot of people are not aware that it can be used in the crow's feet area. Yes, it can be. And people have concerns that, what about my smile? It's going to look fake. No, it will not. But the reality is that smile is perceived by the brain by the sparkle in the eyes that happens, not from the lines. So if I didn't tell you, you would not know that I have Botox around my eyes and the crow's feet. But I can still smile. So don't let that stop you. You will always be able to smile. Sometimes it can be used in unusual situations, because it's being used everywhere, all the way down to the prostate area, believe it or not. So this is drooping of the mouth from a muscle that pulls it down. You can inject that area, and the corner of the mouth goes up. So you can turn a frown from upside down back upside up. However, I don't use it frequently for this area, as this is a tricky area, and a little higher dose can twist the smile as well. So not a very good area to use it. Now let's get to the fillers. So we did the skincare for the skin envelope. Now for the contents, the structure, because we don't have much we can do, so we gotta just fill up that area with something. Now, so we lose collagen. So how about using collagen? Why not pump collagen right in there? That was the very first filler we had long ago. And it was really horrible looking back, because up to 20% people were allergic to it. And it required 2 skin tests to do, and it lasted 2 months at the most. And that's why it went out of vogue, and I'm so glad that we're done with it, because we have much better things to use these days. And one of the biggest advancements has been hyaluronic acid. These are the 3 brands, Restylane, Juvéderm, Bellotero, that have hyaluronic acid, which is found naturally in the body as well. These are obtained through chemical means and grown in the lab, but it's the same structure. That's why the body agrees with it very well, and we do not need to do any skin testing. Radius. So radius is almost like a bone because it's calcium based. It's almost like a toothpaste. So we can use it to fill our bony areas like cheekbones and chins, and it will last for a year, sometimes even a little longer. Then we come to Sculptra, which is very different than these fillers. It in reality is not a filler but a biostimulator. And you will see more of that word coming down the road. Biostimulators are fillers or injections that will stimulate your skin to produce its own collagen. So in essence, there's no volume created by Sculptra, but your own skin creates a volume after getting Sculptra. Underneath, I have 3 things in red: artifill, silicone, and fat. The reason they are in red is because I don't use them, and I stay away from them for the most part, except for occasional fat injection. And I stay away because, especially silicone, is permanent. And it was very common way back. However, silicone will always stay the same, your body will not. And as you get older, it will sink down by gravity. And I've seen this a lot in the lips that were injected in New York City 20 years ago by famous dermatologists. Now those lips unfortunately have changed and they look deformed. Those cheeks, they look deformed. Even on the buttock area looks deformed. And people are now getting them removed, and you cannot remove silicone. You can only cut out the loose tissue that looks deformed, but you cannot remove it. It's physically impossible to remove silicone. And if you ever want to see what it can do, I have a video on YouTube titled Reduction of Silicone Lips. If you watch that video, you'll understand why. Next thing is artifill, which has polymethyl methacrylate, and same with Balafil. Balafil is a new one that's being promoted, and a lot of people call the office like, oh, do you use it for acne? No, I don't, because that is permanent, and it also has collagen, 2 of the things I don't like, so I will not use Balafil. So please stay away from those, in my opinion, in my humble opinion, because there are many of the great esteemed plastic surgeons who would disagree, and I respect that. And that's the beauty of having different minds, having different approaches, because that gives you progress and that gives you different opinions. It's up to the consumer or the patient to figure out what do I feel comfortable with. But in my honest opinion, I think we have to stay away from those. Fat. Fat is very good because that's your own fat, but the problem with fat is 2 things. One, if it gets injected in some area and you don't like it, you really can't remove it without having a problem. You can try to liposuction it and you might be successful, but then you can sometimes have dimpling as well. And you can have irregular area as well, and then you got nothing. You don't know what to do then. And then you try to put some filler in, then you take it out, then you put it in. So it becomes really a yo-yo phenomenon. So it's not really that great in my opinion. And also there's a very minute risk of blindness from filler injections. And fat has been shown to have the highest that I have noticed that can cause blindness. It's not talked about, but that's a fact. So you have to be very careful with those little things. So the common areas where we inject the fillers would be the nasolabial grooves, just to soften them up. Lips. A lot of people have lips that are really small, so you can plump them up nicely without making them too big. Because unfortunately, sometimes people get carried away and it does not look natural or pretty.
It doesn't.
It does not. And many a time you will see and and you will feel like, I need to tell this person it's not looking good, but you can't. You can't. And then you can also use it for hollow eyes, right, underneath the eyes, and instantaneously you can reduce the baggy look under the eyes. Also in the puppet or the marionette lines, it can also help in lifting the corners of your mouth. So if somebody has a frown, you can really lift it up and make the face look happier. Sculptra is more generalized, as I was saying, that it is used to rejuvenate the face and make your own collagen, so it's not put in one spot, but kind of all over, mostly in the cheek area, to start giving a little subtle change with time. So you will see there's a subtle change, and with Sculptra, people cannot tell, patients cannot tell that, where's my change? And the way I tell them to notice is if you're getting compliments, or if somebody says, well, you still look good. Or look at your old pictures from year to year, Christmas photographs or holiday photographs, and you'll see, wow, I'm not aging. Well, that's because of Sculptra. And so Sculptra is very good. The problem is all the pictures I showed you, there was not anybody in their 20s or 30s. That's the time to start so you can produce a collagen that you're losing, because even in your 20s, you are losing collagen. So if you keep rebuilding that collagen, you will stay at that spot. You will not go down your age path. So now let's kind of revamp it also for the skin, which is the envelope, and the structure, which is the contents. For skin, we have Skin Care, DERMASWEEP, REJUVA-PEN, THERMISMOOTH, BOTOX, and Dysport. For the structure, we don't have any good option, unfortunately. We don't, because ideally it would be like, you have lost bone, I'm going to inject bone, and great, you've lost some fat, inject some fat, or cartilage, or muscle, whatever we can find. We don't have that. So the closest we can get to making you produce your own stuff would be Sculptra, a biostimulator. And there's only one of that. All the others are many companies. Right now it's only Sculptra. I'm hoping more will come out which do the same thing, and then we can inject. But along with Sculptra, we have Restylane, Juvederm, Belotero, Radius for the structure. So now, the red thing in the bottom is stem cell. Not because it's bad, because it's red hot. Red hot meaning it's the future. It's the future because they really are making great strides with stem cell. And the hope is that one day we will be able to take stem cells from your own body and train them to become any tissue we want. So if somebody is losing fat in a certain area, we can put your stem cells and tell them with the growth factors specific to fat to make fat in that area, or make collagen, or make elastin, anything we want, or even muscle. So that's not science fiction, that is already happening, and within hopefully 15 to 20 years we will have that available. That's the forecast, but they've been wrong before, but that is definitely the future. Now let's get to surgery. When you're young, you don't need surgery because it's all about prevention, 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 and that's great. However, there are a few things that unfortunately you cannot prevent. It is what it is. If you have a nose that you were born with that's really big, you can't help it. You need to have a rhinoplasty to make it aesthetically pleasing. If you're born with a very small chin, we don't have the mechanism to make it grow, so we have to put a chin implant to make the face more proportionate and improve the profile. If the ears stick out, we have to do the surgery. So let's go over some of these surgeries quickly. Well, the most common reason for rhinoplasty or a nose job is a hump on the nose. That's a very common thing. Followed by a crooked nose, and then by a tip that's big, that looks a little bulbous or round. And lastly, sometimes wide nostrils, which are common in the African Americans, but even in that group, some people feel they're too big for them, so they want to reduce those in size. This is just some terminology. If somebody goes looking, and especially young people, and they want to educate themselves what it is, these are the different names. You can Google them and find it. So when you go to the blogs or the consumer websites, you can make sense of what is being talked about, because these days it's very easy to access information and knowledge. The hardest thing is going through it and making sense of it, because there's too much of it. So you have to be really well educated on everything, including the terminology of different areas. So these are just some examples to show you the big nasal humps that can make or break your appearance. In this case, the gentleman, he's a nice, handsome young man. He was about to go to college. He had this big nose, and along with that, unfortunately, a small chin as well. That was making him a little self-conscious. So when he came to me, I recommended doing chin implant and a rhinoplasty. He decided to do only the rhinoplasty first and see how good he looks. And if he's happy, he'll stop. If not, he can do the chin implant. And you can see that the change was so dramatic for him that he said, I don't need a chin implant. I'm so happy. I'm I am delighted. I am just a completely different man. So that gave him the self-esteem boost that he was looking for, and he went off to college.
Wow. That's good.
This is again a subtle nose hump, not big, but enough to bother the person. So that's one of those examples where if it is not bothering the person, they don't need to do it. There's nothing wrong with this nose at all. But if it bothers them, is it justified to do it? Absolutely. And that little change, it's not a big change, but that little change was enough to make him happy and make him feel more confident. In this case, it was a big issue because this lady couldn't breathe. She had problems inside the nose, and also she just did not like the shape of her nose. It looked too big to her.
Wow. Whoa.
So that changed her whole perspective, not just by looks, but also in terms of her breathing as well. So imagine going like this to college when you've changed. And I've had a lot of young ladies come and say, I want to have a fresh start, so when I go to college, I don't want to do it at that time because then everybody will know that that's not me. But if I'm going to college with a new nose, that's me. They'll never have to think twice unless they go back to the yearbook. Tipplasty. A lot of times it's not a big issue with the whole nose, but just the tip, and you can fix that as well. If the tip is a little wide, it's very easy to narrow it without doing a full nose job. And that will give the subtle change that people want. As you can see, this tip is really difficult tip. It does not look nice, especially on a woman. It would not look very pretty. So making it narrow changes everything. Shannon, I'm sorry I'm in your way. Or a crooked tip where you put it back straight and the whole nose looks better. Now we're going to alarplasty. Alarplasty is the wide nostrils which can be narrowed, and that subtle change in the nostrils can change the appearance of the nose, especially when somebody smiles. Because when smiling, the nostrils get wider. And for some people, they can become so wide that it's embarrassing for them. Okay, so next we go on to the chin implant. So small chin or a very large nose. Those are the two reasons to do the chin implant. Your chin could be like, maybe borderline, but if you have a really large nose and you say, I don't want a nose job, but can you fix my profile? Yes, we can put a chin implant and fix the profile. This beautiful young lady came to me for a rhinoplasty, and she said, my nose is too big, can you fix it? I took a look and I said, I hate to tell you, but I think if you did a chin implant, you wouldn't need a nose job. She didn't believe me, and her mother was like, well, maybe we need a second opinion. So I said, let's take a look, and finally they decided to go ahead, and we did the chin implant. And that changed her whole look, and the nose did not look that big anymore. And it took the focus or her eyes off the nose. Because when she was looking at her face, she just didn't like something, but she didn't know what it was. She thought it's her nose. But the more she looked, the more she realized that it was not the nose. Nose was fine. There was no chin. So that small chin implant saved her nose job. And I can assure you the nose has not been touched and it looks different. This lady waited a little too long. I wish she had done it earlier, but you can see that she literally has no chin. And then with the chin implant, her whole look completely changed. Very subtle change. A beautiful young lady who had a good chin, but she just felt that the neck was acting up a little bit and just didn't feel right. The moment we did that, it pulled the skin forward and the neck looks better as well. And lastly, otoplasty. If somebody did not get it done when they were young and they're in their 20s, and at that point they say, oh my God, mom never took care of me. I got to do something myself. Well, it's never late. Don't go bash mom. Maybe, she didn't have the money. Maybe she didn't realize that you really need to do it, but you can still get it done. And I had actually somebody who was a hairdresser. She came in when she was 25, and she was literally in tears afterward because she said, this is the first time that I have put my hair up in 26 years. So you can see that, she's a gorgeous woman and she just didn't like, and that's very subtle, it's not bad at all. But for her, it was bad enough that it bothered her all her life, and she just never fixed it. Finally, she said, I will do it. And once she did it, it changed her whole demeanor for herself. So I think that was the last slide. So At this point, we're done, and if you have any questions, please, I'm ready. And also, anybody, if they're listening on Ustream, if they want to call in for questions, you can call in the following number: 908 268 9350. I'll repeat the number: 908 268 9350. Thank you. And before we go on to questions, our next seminar will be at Bridgewater Marriott on November 10th, and it will be the other end of the spectrum. It will be for people 50 and over, and it will be titled Facial Makeover. Now with that, I'm open to any questions, please.
You're so thorough.
Thank you. Yes.
Did you use the THERMISMOOTH on my mom? Is that the thing around her eye?
Do you have her permission for me to tell? Because I'll be violating her.
Does anybody know my mom?
Nope.
Nobody knows. Oh,
All right.
good, perfect. Yes, yes, I did.
Okay, cool.
Good.
I was like, oh, Mom.
Just don't say your mom's name. That's it. Don't say your mom's name, and then we are all kosher. Yes.
Hi. So I use acne medication.
Okay.
And a lot of the things that you were saying I found interesting because it's totally opposite of what my dermatologist says.
Yes.
So I don't like
Yes, yes, yes. You see the excitement on my face? Because I used to get acne every now and then a little bit, and I finally got it. So I've had some very difficult cases where, I'm not a dermatologist, so I never got into it, but then I finally, since I've thought about it a lot, I realized the problem, so I became good at it. And I made your diagnosis right away as well. The problem in your case is this. Even when you started talking to me, you were like this, and you were this. So when I do an acne consultation with patients, I tell them, you will not remember most of what we talk about today. That's normal because there's so much information. I only want you to remember one thing, and remember it really well. And that is, acne is not on your face. It's on your fingertips. And they look at me like, really? I'm like, yes. I can tell you that I can do whatever in the world I can, and you will not get better unless you keep your hands off your face. And it's very tricky, and they'll say, well, how do I scratch or touch? I understand it's very hard. You wash your face several times a day, as much as you can. And then, when you feel that there's an itch and you're in the car and you can't wash your hands and you really have to and you're dying, what I do is I just use my knuckles in the back of my hand to scratch if I really, really have to. Why? Because if I'm touching everything with my fingertips, most likely I picked up something bad, but with knuckles, most likely no. With my wrist, probably not. So that's one thing. And then along with that, that anything that comes in touch with your face, make sure it's clean. For example, glasses. How many of us use an alcohol wipe and clean the glasses? We don't. I started breaking out last winter, and I'm like, oh, this is not looking good, and it's only on the forehead. What is going on? And finally it hit me like, aha, my ski goggles. I never clean my ski goggles. Did anybody clean the ski goggles? No. It was full of sweat. It was sitting there all the time, and I'm like, that's what it is. And so those simple things make a big difference. Once you understand that, pillowcases, how many of us with acne should change the pillowcase every night? You got to. If not, flip it over to the other side. Can't find a pillowcase?
Bacteria grows on pillows.
Yes. You know why? Because when you go there with acne, 8 hours, you're rubbing the bacteria. Next night, you come to the same pillow. And if you don't change it, sounds very simplistic almost, but it makes a difference. So along with those things, then if you get into the skin care and you do it religiously, it makes a big difference. Obviously, there are some people who have such bad acne that they end up like getting strong medications and finally Accutane. That's true. That's correct. But for most acne patients, if they follow the simple stuff and use some, the stuff that I talked about, I've tried it myself, it definitely works. And if it's not working, then I have Gina do the DermaSweep, the microdermabrasion, and that adds on to it very nicely.
But for the microdermabrasion, the dermatologist says not to do that because it's too harsh on the skin.
It depends on who's doing it, how it's doing it, and also how clean it is. I mean, not all the places have the same cleanliness as well, but if done properly, with proper hygiene, and not too aggressive, it is a wonderful thing because you're exfoliating, you're unclogging all the clogged pores. And then on top of that, if you can infuse salicylic acid or something right at the time, it will kill those bacteria and it'll help against the acne. So I respectfully disagree with that doctor who told you that.
Thank you.
You're welcome. Yes.
If you've had fillers,
Yes.
you do the Juvapen, right after fillers, or do you have to wait a while, and how often do you have to get the Rejuven?
Well, you can do it right away, but Gina doesn't like to do it right away. She thinks something might go wrong. The reality is, I feel that after I've done the fillers, you can go right to her and get it done, no problem. Because the depth of the filler is deeper and I don't see any issue at all. And you can do it as frequently as once a month. And the reason for that is because pretty much everything that I do on the skin, I wait for a month typically, and the reason is that the healing process that happens underneath the skin surface at the deeper levels takes 3 weeks for any kind of trauma. So waiting for a month is a good general measure to follow. And that's true for like lasers, IPLs, Rejuven, all those things, except the DermaSweep is very gentle. Again, the DermaSweep or most microdermabrasions are very gentle. You could do it once a week if you had to. But Rejuven is more intense, just like other lasers, so 1 month is a good time period. And typically you should not need more than like 3 or 4 sessions. After that you're good, because that's you've done the maintaining. Then you maybe do it like once every 3 months or once every 6 months. That's it.
I just want to say I think it's fabulous.
Which one?
The pen.
Thank you. Thank you.
I loved it.
Yes, well, I have to thank
I
Gina.
had such great
Yes.
results, yeah.
Honestly, because I looked into the pen a while back. I wasn't sure. I'm like, I'm not getting into the practice. And then she pushed me. So, and she's so, she's so nice. Whatever she says, I accept it. So I'm like, fine, let's get it. And it was right. It really has been very good. Yes.
With the retinol, why didn't you like that again? You said it makes your skin red?
It makes your skin red and irritates
Really?
it.
Because
Yes.
I use that. I haven't found that with my skin at all.
Yes, which is good. You know what? But your skin is a little bit thicker. If you look at somebody who's like really, Swedish or Northern European with very pale and very fragile
Okay.
porcelain skin, they get red, and then they end up developing like rosacea faster.
Oh, boy.
That's what happens.
No.
So somebody like me, I could use Retin-A and it would do great.
Right.
But I don't feel that it does a lot that we cannot get from other products without a lot of peeling, redness, and photosensitivity. Oh, thank you for the point. Yes, sorry for my excitement. It's very important because for all the young women who are listening, it's very important to know that Retin-A or any retinol products can cause birth defects.
Oh.
And that's one of the reasons that I have not been in favor, because somebody in a young age might be using it without even realizing it. And then if they get pregnant and they don't realize, nobody tells them, they could have birth defects.
Oh,
So that alone is enough for me to say like, I don't think so, especially when there are alternatives available.
Now, the big buzzword now is like caffeine in certain moisturizers. Do you have an opinion on that?
I like it in the cup.
But really, that's,
It is.
caffeine is like a big
It
thing.
is.
so-
I think it's a fad, like
All
many of
right.
the things that come and go.
Yeah.
Same with technology, same with, no, seriously, it is. It's very hard. And for me, the hardest thing is to figure out all these different things and go through them to figure out what is right, what is not. Especially when you're buying machines and stuff, because there's so much out there that doesn't work. And same with the skin cares as well and everything, so it is so difficult to figure out. So the caffeine might have some effect, but I don't think it is one of those like medical things where you'll be like, wow. I really think eventually down the road when stem cells come and they can figure something with stem cells, that'll be a big change. But till then, I don't see anything magical.
Okay.
So if there's a difference between different skin care or different products, might be a little bit, not enough to spend all that extra money.
Good, thank you.
You're welcome. Young lady, do you have any questions? I am so happy to have you here. Yes.
I did have a question. Do you have an opinion as far as preventative measures
Yeah.
on sleeping?
Mm.
Should you be sleeping? Because many, many years ago when I was in my 20s, a woman who had visited several spas in Switzerland and traveled a lot said that her esthetician, when she was abroad, told her it's very important to sleep on your back, not only for lines on your face, but also especially if you are well endowed and have large breasts, to not be constantly sleeping on your side. So I took it to heart, and for a week it took training to sleep on my back. Do you have an opinion on that? Should you also be sleeping without a pillow so maybe you're getting more blood to your face?
Excellent, I'm so glad it's been some great questions, the retinol one and this one, because this is very near and dear to my heart, because it is important to realize, I remember we talked about the beauty and the prevention from two approaches, inside out and outside in. So outside in is what I do, all the superficial stuff. Inside out is the healthy living part. So in the healthy living part, one of the most critical things is sleep. Sleep is so important, especially for these young people that I wish they really focused on it, that any way you can get sleep, get it. It doesn't matter if you're on your side, on your back, on your front, does not matter at all. There have been no studies or no strong information that has proven that sleeping on the back is going to make a difference. Absolutely not. The most that can happen is if you're sleeping on the side, you might get an extra line or something, but that line would only happen if you're losing collagen. If you're preventing that from happening, you will never get a line. You never will, no matter how you sleep. So sleep is critical. So somebody who said like maybe sleep a certain way to prevent aging, I think that's a very bad idea. I think it's much better to sleep a way that makes you most comfortable so you can get sleep. And as long as you're getting enough sleep, because that definitely makes a difference. Yes?
How does the ThermoSmooth compare to ultrasound for collagen production?
Ultrasound does not generate heat. And I think maybe it does, but I'm not aware that it does. So it does not. So they don't know the exact principle behind what causes the radio frequency generated heat to lead to all those changes. But since ultrasound does not produce the heat, I don't think it can get the same effect. Or I haven't come across any ultrasound-based machine that has shown any benefit. If you're aware of something, tell me. I want to look it up then. But I think that's the, I honestly, I'm guessing right now, but that's my guess, that since it does not generate heat, that does not carry the same effect.
The TherMisMooth, you would need how many treatments for fine lines above the lip?
Depends. You know, if you're starting early, I typically say 3 to 5. 3 to 5 is a good, because if past 5, I don't think it's going to get any better. And that's the reason that I would say, you know what, let's stop, let's try a filler. So that's the range that I would give. Any more questions? I want to thank you all for coming. I know it's hard to make time, but I hope this helped you a little bit. And not just you, but hopefully your friends, your relatives, your family members, because you've learned a few new things. And we'll do it again sometime. Thank you again. Drive safe.